A court in Nairobi has extended the suspension of plans to open an Ebola quarantine facility for U.S. nationals in Kenya. The proposal has led to a backlash. On Monday, hundreds of people protested in the Kenyan town of Nanyuki. Critics say the nation's healthcare system is too fragile to be coping with quarantining foreign Ebola patients.
They cannot do that because the Americans, they are so very selfish. They say this is an institution or it's a quarantine facility for only the Americans. So the Americans are selfish to the core. And we have to tell Americans to get off our noses business. Get off our noses business. Get off our skin.
We are saddened today, such a bad morning, knowing that we have in the Laikipia Air Base compound, we have a primary school with retro kids over there who are our kids. And it's so bad that even the president himself, the man who called himself the president of the Republic of Kenya, didn't even consider these small kids, didn't even consider or ask around what happens and what goes around in the Batuk area or the Laikipia Air Base compound.
I'm joined now by Isaac Mwaura. He's the Kenyan government spokesperson, and he joins us live from Nairobi. Mr. Mwaura, thank you very much for being with us. Will the government abide by the court's decision to halt the opening of this Ebola quarantine facility?
We have many facilities in the country that really deal with the issues of such emergencies. And when we cooperate with the US government, it is the way we do at the international level with all of other countries. If, for example, Kenya has a pandemic, we are able to also get support from other people. And it is important to actually put it very clear. Even when you look at the US, people that we'd like, to work with, and we are willing to work with. We have many Kenyans, and we have Kenyan banks like Kenya Commercial Bank, Equity. We have the security personnel who are in DR Congo, such as place. So you cannot say, therefore, then that these things will not happen to Kenyans. We are making sure that Kenya is people are screened across all our borders already. Right now, as we speak, 37 people who came from Congo are under quarantine, just to make sure that we secure everybody without a doubt.
I take that point, but the issue that the protesters have is specifically with this facility that was negotiated to quarantine U.S. nationals. Can you tell us more about what was negotiated with the Americans for this facility? Because there have been accusations from people who say that this deal has not been transparent and people don't know what was negotiated here.
I think all the issues that have been addressed in the past concerning the health, collaboration between Kenya and the U.S. are in the public domain. The United States is supporting us directly, close to over 200 billion Kenya shillings that we are getting to support our health systems. And so, therefore, it remains extremely important. It remains extremely important. Sorry about that. It remains extremely important that we also collaborate with them when it comes to matters public health. There is nothing that is being hidden. Anyone, whether a Kenyan or an American citizen, can actually get disease. And so, therefore, when we are strengthening our 23 facilities, to ensure that they are well taken care of, it is just go ahead to demonstrate our commitment as a country to that we care about the lives of fellow Kenyans. So it is really, people are trying to politicize this whole matter, madam, and I think that is not right, because during COVID, we got support from the Americans.
Right.
HIV and AIDS, we have actually been benefiting from PEPFAR and such others. So when Americans also, would like to us to support them in one way or another, I think it is that spirit of reciprocity. But what we are seeing is a situation where our political competitors are trying, to create a lot of charade about it.
Just to that point, though, are the Kenyan people who are protesting here then, are they wrong that this is going to be a facility to quarantine U.S. nationals, or is this also planned to quarantine anybody in the country who comes down with Ebola?
First and foremost, we want to assure fellow Kenyans that we have taken measures and we continue to take measures to ensure that there is no transmission of disease between any other nationals and Kenyans. And that is why, for example, we've quarantined our own fellow Kenyans, 37 of them, when they're coming from DR Congo. It's also, we also need to understand very well that we have 23 other facilities. Kenyatta National Hospital, we have KU referral. There are quite a number of them. We've even classified our counties, the ones that are high risk and the ones that are mid risk and all that, because we are taking precautionary measures. So any idea of anyone thinking like then that this is something that we have not thought about, I think really they are just trying to play politics with the matter. We are on top of the game, and we will support Americans just like they have supported us, and we'll make sure that Kenyans are fairly and well supported.
But why would Kenya plan to host foreign nationals, host exposed U.S. citizens, despite not being the epicenter of this outbreak and despite not having, as far as we know, any reported cases from this outbreak?
Kenya has always hosted foreign nationals, including refugees. I think we have had the biggest refugee camp from neighboring countries. We are an island of peace. We are the most stable economy in East and Central Africa. We lead, we follow. We are the only country in the global south that hosts the UN headquarters, So we are used to hosting people. We are a hospitable people. So that should not even arise because we always do so. Just like when Kenyans are in distress, they are also supported by other countries.
So then what is the government doing to address the concerns? Sorry, what then is the government doing to address the concerns of the protesters?
First and foremost, I think it's important that we are trying to create awareness about this whole issue. And I thank Al Jazeera for giving us the opportunity to also explain at the international level about the transparency and the openness that we have with the Americans. Secondly, we are also trying to tell people how to protect themselves. We are taking measures just like the government should, by screening people, by also telling them the signs and all of that, just like we were able to deal with the last huge pandemic of COVID, and we'll continue to do so. So Kenyans should remain calm and trust their government that we have their best interests at heart, led by none other than His Excellency the President.
Kenya's healthcare system is already struggling. The U.S. intends to provide $13.5 million in aid to help set up this facility. What was it agreed that would go towards?
Yeah, you see, most of the funding is going to strengthen systems and structures to ensure that then we are able to deal with whatever issues that arise. Remember very well, we've been receiving a lot of support even on the issue of HIV and AIDS. Now we have also other diseases that are arising, including cancer and all of that. So all of it's a holistic approach to medical intervention, and that is very welcome. Such that if it's Ebola today, we are able to deal with it. If it's malaria tomorrow, we are able to deal with that. It's a very comprehensive exercise. And also, it's important to say that such money is used to also go through non-governmental organizations. And of course, you'll find some of them also not being very happy about this arrangement because this is a government-to-government engagement. And we are very, very confident about the fact that it will reach even to those Kenyans who may have fears that then they will also benefit from this partnership, because it's about ensuring that our public health institutions, our hospitals, our research, our medical equipment, we are very keen on producing, for example, pharmaceuticals here, because, Africa has got 25% mobility, but only producing only 6% of its medicines from here. Those are the systems that this, nearly 200 billion Kenya shillings or $13.5 million, as you put it, are going to support.
What do you say to the critics and to the protesters who say that the government is prioritizing international agreements over the safety and the consent of its own citizens to have a facility like this built in their community?
Look, my dear sister, no country can live is an island of their own, honestly. We are in a community of nations. We are in a committee of nations. And so, therefore, when we receive support, from those other countries, when they also receive our support in this regard, it is for the common good of all. Because by the end of the day, we are all human beings. When we have, facilities, the 23 of them, including the one in Laikipia, that are able to help in the treatment of Ebola, when we have quarantine facilities, when we have treatment facilities, they will take care of those who may be brought in, but also those who may get sick here. You see, right now, we are speaking like this, yet we have people who are quarantined. Suppose they also turn out positive. These same facilities will be useful, the 23 of them, to treat any Kenyan without any fear of discrimination. As I told you earlier on, our country has got installations and institutions there. Kenya Commercial Bank is in DR Congo. Equity Bank, we have our security people. We provide security forces there. There are diplomats who are there. They would have already come to the country. You never know whether they have the Ebola disease. So let's not try to make it look like it is the Americans who are bringing Ebola to Kenya. That's not true. It's a regional issue. It is affecting countries, even including our neighbors who you know very well. So we are taking all the precautionary measures by ensuring that our facilities can match up to the need for treatment and care as and when such situations arise.
Isaac Mwaura, Kenyan government spokesperson, we appreciate your time and having you join us here on Al Jazeera. Thank you.